Anatomy station thorax. Doctor, you can see the screen.
Yes.
Okay, we are starting. Time starting now. Identify the ascending aorta, right ventricle, right atrium, conus arteriosus, and pulmonary trunk.
Okay, so ascending aorta is number 3. Right ventricle is dissected here. Right auricle is number 4. Uh,
Right
conus
atrium,
arteriosus.
right atrium,
Oh, okay, right atrium is number 10, and conus arteriosus is number 7, and pulmonary trunk is number 9.
mention the branches of ascending aorta.
Right and left coronary arteries.
Mention the branches and vertebral level of the pulmonary trunk.
The branches of pulmonary trunk is left and right pulmonary arteries, and it's situated at the level of T4 to 5.
What are these structures? Number 1, 5, and 2.
Number 1 is the anterior cusp of tricuspid valve. Number 5 is chorda tendineae, and number 2 is anterior papillary muscle of
What
right
are
ventricle.
the functions of chorda tendineae?
They prevent collapse of tricuspid valve during ventricular systole.
Mention the structures passing in the lung hilum with number of each.
Okay, so there are there's one pulmonary artery, 2 pulmonary veins, and uh, one principal bronchus.
Anything else in lung hilum?
And pulmonary ligament, I don't know, lymph nodes,
Lymph nodes and
and pulmonary ligament.
no.
mm, I don't know what is the other one.
Okay, it is bronchial artery and vein, also autonomic nerve. Okay. What are the bony attachments of diaphragm?
Anteriorly, it is attached to the xiphoid process, and on the sides, from lower through the lower 6 ribs, and posteriorly, there is there is 2 crus, right and left crus. Right crus is from first lumbar to third lumbar vertebra, and left crus is from first lumbar to second lumbar. And there are 3 ligaments: medial and lateral arcuate ligament. Medial arcuate ligament extends from the side of the body of L1 to the tip of the transverse process of first lumbar vertebra. Median arcuate ligament is between left crus and right crus. Medial arcuate ligament is from the side of the body of first lumbar vertebra to the tip of transverse process of first lumbar vertebra. And lateral arcuate ligament is from the transverse process of L1 to the lower edge of 12.
12 rib.
Yeah.
Okay. At which level does inferior vena cava sit?
At the level of 8th thoracic vertebra.
Which part of the diaphragm does inferior vena cava
It pierces the central tendon.
Which structure accompany it?
Right phrenic nerve.
What are the structure where to auscultate for pulmonary and aortic valve?
Okay, so for Aortic valve, it's on the right second intercostal space along the parasternal edge, and for tricuspid valve, sorry, pulmonary valve, it's on the left second intercostal space on the parasternal edge.
Okay. Identify structure number 4, 5, and 6.
Number 4 is the pulmonary trunk. Number 5 is the ascending aorta. Number 6 is superior vena cava.
Identify structure A, B, C, D.
A is brachiocephalic trunk. B is left common carotid artery. C is left subclavian artery, and D is arch of the aorta.
Identify structure number 2198.
In which picture?
In right and left both.
Okay. So on the right side, number 1 is right principal bronchus. Number 2 is branches of pulmonary arteries and pulmonary artery, and number 9 is branches of pulmonary vein. 8, I'm not sure what's the right
8.
picture. And on the
Here is the 8. Here is the number 8.
Yeah. On the left lung, number 8 is the pulmonary ligament.
Okay. What attaches the lung to the diaphragm?
Pulmonary ligament.
Okay. Okay. Well done. You did it in 6 minutes and 40 seconds. Very good.
There are a few questions, some extra questions
Yeah.
in this
In real
station.
exam, there will be more questions, and they will not ask only from one picture or two picture. There will be multiple picture in every station. At least 4, 5.
Really?
Yeah.
Okay. Are those easier to identify or complicated?
They are not very complicated. They are easier. Depends on your mental state. If they give those picture right now, you can answer everything. But depends on your previous station. How was that? Your mental stability. Your what I say, your exam phobia. If you can control this thing, then this picture will seem like very easy. Otherwise, even a normal, maybe they will ask what is it, number 19, and it will be difficult.
Okay. There is another question here in the new mock. What is the origin of pulmonary ligament?
So what is the answer?
Pleural fold.
Pleural fold. Okay. Origin of pulmonary ligament.
And then,
pleural fold. Okay.
yes, and then what structure passes in front and behind the hilum of the lungs? We know this.
Okay.
Anteriorly is the phrenic nerve, posteriorly is the vagus. That's it. These two are the new questions from this. And also, how many casts in pulmonary valve?
Pulmonary, there will be 3.
From the lecture. Yeah. All the valves have
all
3
have
casts
3 except
mitral.
Yes. Except bicuspid.
Okay.
Pulmonary fold, right? You said pulmonary fold. Origin of pulmonary ligament is
Yes,
pulmonary
yes.
fold.
Pulmonary fold. And what is the significance of pulmonary ligament?
It allows lung expansion during cardiac cycle, where it allows
during pulmonary hypertension.
Pulmonary hypertension, yes.
Just like the femoral canal, which allows expansion
during
that thing. I don't remember if there is any pressure in the. Next.
okay. You can ask me, I will try to answer this one.
Isn't this station old?
I
Do we
think
have a new
this is not the complete one because here there is some lever, but in thorax we don't have lever.
Yes, let me check. There is a new station liver in Pune. Okay.
The one you sent me, that is the newest one.
No, no, no.
In that,
That's the May one.
but it is same. I have seen that one. The pic,
Very few questions have been added, so it's the same as the other.
okay, okay, then we can start this station. You can ask me, I will answer, and maybe next.
Did you set the timer?
Yeah, it's ready. Start.
Can you show me right atrium and left ventricle?
Right atrium number 18, left ventricle number 11.
Okay. Identify atrial auricle
Atrial auricle number 5.
and
Okay, right atrial auricle number 5 and left atrial auricle number 4.
identify pulmonary trunk.
Pulmonary trunk number 17.
Okay. What are the parts of pulmonary trunk?
Right and left pulmonary artery.
Next. Can you identify structure number 1, 2, 9, and 8 in the picture?
Number 1, branches of the principal bronchus in right lung, in left lung as well. In right lung, number 2, they are branches of the pulmonary artery in left lung as well. In right lung, number 9, these are the branches of the pulmonary vein, tributaries of pulmonary vein. And number 8 is in left lung, which is pulmonary ligament.
What attaches lung to the diaphragm?
Pulmonary ligament.
Identify structure number 21.
21 is quadrate lobe. Sorry, 21 is quadrate lobe. Number 2 is caudate lobe. Number 17 is ligamentum teres and falciparum ligament in fissure for ligamentum teres. And number 13 is inferior vena cava. Number 20 is portal vein. Number
Mm.
11 is hepatic artery, and number 5 is common hepatic duct.
Is this common hepatic duct or common bile? আমি এটা দুই জায়গায় দুই আনসার পেয়েছি। Number
It will
5.
be common hepatic duct because uh,
Because it hasn't crossed cystic duct.
yes, from right
It
and
had,
left
I don't know.
lobe, both right hepatic duct and left hepatic duct will come and they will form common hepatic duct and it will descend, then cystic duct will join to form the common bile duct.
Okay, so if the body is stacked in the epigastric region from inferior to superior, what structures are at risk?
Left lobe of the liver and stomach.
And
Diaphragm as well.
yes, where does left lobe of liver extend to on surface anatomy?
It extends up to fifth left intercostal space in mid-clavicular line.
What are the boundaries of quadrate and caudate lobes?
Okay, quadrate lobe and the left, ligamentum teres, the right, gallbladder, anteriorly, anterior free margin of the liver, and posteriorly, porta hepatis. And
Caudate?
caudate lobe, in the left, there will be fissure for ligamentum venosum. In the right, inferior vena cava, and inferiorly, porta hepatis.
Mhm. Then
And anteriorly, free margin of the liver. This one, I forgot.
no, bare
This
area.
one, bare area of the liver. Bare area of the liver.
What is the blood supply of quadrate lobe? This is a new question.
From um, left hepatic artery.
Mhm. Yes, left hepatic. I used to think this is from the right hepatic. So it's left hepatic artery and portal vein because portal vein supplies gives 80% of the
Heart,
oxygen.
liver, yes. Okay.
Okay, next, what structure separates right and left lobes of the?
Anteriorly, it is separated by falciparum ligament, and posterior inferiorly by ligamentum teres and ligamentum venosum.
Mention one ligament that connects liver to the diaphragm.
Falciparum ligament.
Yes. What is it composed of?
Okay. Okay. This seems like a new question. Maybe it is right and left
Yes.
triangular ligament and coronary ligament. I'm not sure.
No, no. What is falciform ligament composed?
Composed of. It is. It is a band of fibrous tissue. I'm not sure. What is falciparum ligament composed of?
I wrote it somewhere. Can you identify falciform ligament in the picture?
Yes. This is the falciparum ligament. Because anteriorly it separates.
They
Right.
ask the same question in a different way because question number 12 is answered for the question that I asked you. What connects liver to the
But what is the answer? What is falciparum ligament composed
Yes,
of?
I will give it to you. I wrote it somewhere. Okay, so it is composed of two layers of peritoneum and fat. That's it.
Two layers of peritoneum and fat.
And what does it contain? Falciparum ligament. What does it contain?
Umbilical in
Hmm?
umbilical vein,
Paraumbilical veins and round ligament.
round ligament.
Paraumbilical veins and
Paraumbilical,
round. There are two paraumbilical veins. So just say paraumbilical veins and round ligament.
contains round paraumbilical vein and round ligament. Okay. Okay. Then
That's all for. Okay. What are the attachments of liver to the duct?
is falciparum ligament
And
and triangular right and left triangular ligament and
mhm.
upper and lower coronary ligament.
uh, what are the attachments of the duct?
Diaphragm anteriorly with different process of the sternum and lower six costal cartilage, and posteriorly with lumbar 1, 2, and 3 vertebra.
And tip of transverse process, L1 transverse. What's the venous drainage of liver?
Venous drainage of rib,
Liver.
portal vein, uh,
No, that's
uh,
the it's the
okay,
that's
okay,
the
okay, okay,
artery
okay.
of
Hepatic vein, three hepatic vein,
hepatic veins draining into inferior vena.
directly inferior vena cava.
Mm. So you
And
will say it like this: the
yeah,
right, middle, and left hepatic vein draining into inferior vena.
okay.
Okay. That's all. These are the new questions.
So these are the new questions, I think.
Yes.
Okay, good.
And then pulmonary trunk bifurcates at which level? We know this. Um, okay, there's another question. How to differentiate between left and right lobes of liver?
Anatomically, we can differentiate by the attachment of falciparum ligament anteriorly and posterior inferiorly by ligamentum teres and ligamentum venosum.
Also, left lobe is related to stomach.
Left lobe is
It's
related with
behind
stomach.
stomach.
Okay, okay.
Mhm. That's all.
So we have less than, okay, we have only 3 minutes remaining. We'll start a new session for the remaining, I think remaining two cards are there.
Okay, I will send you two, three pictures. These are new. Maybe these are old, but I haven't seen them before. So I will send you the
Okay,
pictures.
okay, please send. I'm sending the new link.